Thank you very much for inviting me to be here today. I've been absolutely inspired listening to everything that everyone's been doing, and I can't wait to get back to South Australia and tell everyone about it. I'm actually going to talk about something that's very specific, so it's not as broad or as wonderful as some of the things people here have been describing. And Liz was saying earlier that it's something specific, but it has wider application across a number of councils, and that's about healthy eating policy. And I was thinking that one of the good things about this strategy or project has been that it's been a bit of an in for councils. It's something small and specific that councils have felt comfortable with starting with, and then by starting on this, the right people have come around the table, and then they've had conversations about, well, if we're talking about healthy eating guidelines or healthy eating policy, what else does that mean? Like, what does it mean in the broader context? And that's when the discussions happen about some of the things that people here have been describing. So with my talk, I had an epiphany at work, and I read somewhere that the greatest changes in health have been due to policy. So in 1900, the life expectancy was 47 years, whereas now it's closer to 85 years. And the experts say that the biggest, most single influence that has enabled this change has been policy. So it's things like vaccinations, seat belts, tobacco control, etc., all possible through policy. So as an extension of that, healthy eating policy is very enabling. So in New South Wales, you already have some state-level healthy eating policies in your schools and in school canteens, and in your health facilities and in your hospitals. In South Australia, we have similar state-level policies because we took the idea from New South Wales and modified it. And we also have state-level healthy eating policies with regards to our childcare centres and family daycare, and we work very closely with the environmental health officers around there. So SA Health has invested quite a lot in the last 10 years around nutrition, physical activity in health, early childhood and education sector, and now feel that the next taxi off the rank are local government organisations. So there's three reasons why in South Australia we're focusing on healthy eating policy in local governments. The first reason is that the evidence says that policy is your best buy. That will give you the biggest changes with regards to nutrition and healthy eating. The second reason is that there's a shift in funding that's happening at the moment. So primary healthcare, health promotion funding is shifting from the state to the federal. And so SA Health are kind of saying that it's a joint responsibility of other sectors to promote health, and that includes local government organisations. And then the third reason, which is a significant one for South Australia, is that we had our Public Health Act 2011 legislated about 18 months ago, and this now includes an additional principle which requires councils to prevent non-communicable conditions in their community. So what this means is that now councils have a shared responsibility with health to improve the health and well-being of their community through doing these things which will prevent chronic diseases. So this is a significant lever for someone like us, or myself, who's funded by health, coming from with a health agenda, but it's early days. Councils have a couple of years to get their head around this, and potentially healthy eating policy is something that could work within this area. So in South Australia we have 68 councils. 2 years ago the number of councils with healthy eating policy was 0, and within the last 18 months we now have 31 councils who have or are working towards a healthy eating policy. So SA Health found some money to fund our project, which is quite small, to go and work with local governments and support them around healthy eating policy. It was quite daunting because we haven't actually worked with councils before. We didn't have any networks, any contacts. We don't know the business of councils, and lots of other people are knocking on councils' doors with things for councils to do. So we thought we'll consult the literature, see what they say, and we would also partner with the LGA of South Australia. So in the literature, we found that there are 5 tips for a successful healthy eating policy. So anyone can write a healthy eating policy, but if you write it it just sits there on the shelf. It's not a live policy. So with these 5 tips, the literature is saying that the more people who are involved in the development of a healthy eating policy, the more successful it will be. So that's common sense. We know that participation equals ownership. An extension of this is that if the people who develop the policy are also the implementers, then it'll be successful. And again, that's common sense. So if the people who the policy affects write it, then the policy is going to be very realistic. It's going to reflect the needs of that council. The third tip was acknowledgement that food isn't just about health, that food is quite complex. It has social, cultural, a whole range of other meanings. And all the councils feel very strongly about this. They're saying that they use food to attract people to their activities as a means of engaging with their community. Lots of councils in South Australia are concerned about food insecurity. They want food to be available to people who can't afford it or have limited access to it. The fourth tip, which was supported by what council said, was that any sort of healthy eating policy needed to be flexible. So a one-size policy does not fit all, and that's what we tended to use in South Australia. So you can't get a policy for schools, take out the name of the school and put the council in, or have a policy for one council that's going to apply to all the other councils. So it needed to have some sort of flexibility in it, so it reflected all of the unique communities that different councils support. And then the last tip was, that was also supported by councils, was that although they wanted a flexible healthy eating policy, they wanted one that was also consistent within councils, that was consistent with other state level healthy eating policies, and also related to other policies within their council. So we took these 5 tips and we went to the LGA and we said, would you be interested in partnering with us? And they've been absolutely fabulous. They've been our champions. And I'm using a little bit of a cooking theme here, so they're like the baby head chefs. And so they sent an email out to all the councils and they said, anyone interested in being involved in a state-level working group to look at healthy eating policy? We had a great uptake of that. Then the LGA hosted a forum where we invited all of our councils to consider developing a healthy eating policy, which was hosted with SA Health and the Heart Foundation. They trialled the healthy eating policy within their own organisation, which thankfully was they found quite easy and it was successful. And they've also put in some other system changes to support councils. So what the working group of councils came up with was a healthy eating policy framework and template. I know that sounds like weasel words, but it fitted with the 5 tips that we found from the literature. And what they came up with was a template and framework that's in 2 parts. So the first part is very descriptive and it covers purpose, principles, background, policy objectives. And in that bit, councils just add their name into it. And this provides the consistency between councils, but it's also the boring bit of when you're developing these sort of things. So that's all done for them. And then the second part is the flexible bit where individual councils take the healthy eating policy template, and through the process of consultation there's a number of dot points and they flesh it out. They kind of add the detail into it. I'm not going to describe it in detail, but I just wanted to mention that the guiding principles that councils wanted included was acknowledgement that food choice is important. And what they mean by that is actually that a lot of the foods provided through councils, if you want to make a healthy choice, there aren't those choices there. So people who were receiving, the subsidised meals or part of cooking programs or out there in the community, if they were watching their weight or concerned about their cholesterol levels or wanted to eat healthily, they often didn't have those choices. And we know from the ABS data that 9 out of 10 adult people in Australia now have risk factors for chronic disease, and most of those are related to what we eat. So a lot of people are actually looking for healthy food choices. They wanted a principle that acknowledged that food has social, cultural, etc. meaning, and they were also keen to acknowledge that they see themselves as role models. So councils aren't just about the 3 R's, the roads, rates, rubbish. They genuinely want to support the community around their health and their well-being. They wanted the Australian Dietary Guidelines reflected as a principle, and a lot of councils were very keen to include a principle around food and activities related to food being environmentally sustainable. So those things that people describe today about how to minimise food waste, which is a big issue in councils, things like only using local products, encouraging regional producers and local farmers, etc. So the flexible bit was determining who the policy applied to, and councils wanted to do this in small bites. So they wanted the option of doing it in a staged approach. So the first stage was looking at what they provided internally for meetings and functions, conferences. Then the second stage was looking broader than that. So it was looking at what council-sponsored facilities provided, like recreation centres, surf clubs, public libraries, community centres. And then the third bit was looking at creating supportive environments, so making healthier food choices easier choices by changing the environment. So this is where a lot of the strategies people were describing today would sit. So those things that kind of change the environment and make it easier for people. Most councils have started with the first stage, so they wanted to get their own house in order. They wanted to build upon things that they'd already done. But some councils have taken on the first stage and the second stage. So there are councils who are looking at food provision and activities related around that at surf clubs and recreation centres, looking at community programs, looking at community events, meals provided to community groups. And in South Australia, we have 103 community centres who do a lot of work around food security, nutrition and food. And so there's councils and community centres who are looking at having healthy eating policy implemented through their activities. And then the third stage, a lot of councils are already providing, for example, drinking water in public places, but this is where that can be broadened and look much wider to, you know, urban planning decisions, etc. I'm going to skip that bit. So the LGA of South Australia have put in a number of supporting systems, and one, they've created a healthy catering website, so anyone can go on there and download the healthy eating policy framework and template, and a number of other supporting resources, including case studies, FAQs, etc. Queensland councils have the LGA of Queensland and the Heart Foundation have adopted this and used it, sent it out to all of their councils, and 20 councils in Victoria with the Heart Foundation have also adopted a similar approach. The thing that councils have wanted the most support with, because they're starting with the in-house catering, has been around catering, and this was something where they could decide on what was healthy and what wasn't healthy, but we sort of limited it to the options of using a traffic light system like the ones that you currently have in schools, or using the Heart Foundation A Healthier Serve, or using a list of food choices that we came up with that were healthy and ones that weren't so healthy. And this was developed with councils and caterers. And we've worked a lot with the caterers, and they've been really helpful. So we went to them and said, how practical are these suggestions people are making? Like, if you don't have mayonnaise in wraps, will they fall apart? Can you make mini muffins? Those sort of specific things. And a number of caterers have now created healthy eating menus and started looking at their own foods and identifying which ones are health promoting. We're also working with caterers around cost, because in councils, if you replace unhealthy foods with healthy foods, there is a cost difference, but with wise choices you can make it cost competitive. And we're also working with caterers about making the default choices the healthy choices. So if somebody phones up and they don't specify what sort of milk they want, then it's a low-fat milk or a range of different breads, etc. And the other thing we're working with councils are individual councils. People get quite stressed about ordering food because they don't want to make the wrong decision. So we've been sitting down with councils, sourcing all their menus, then working with them to identify the more health promoting items, pulling it out into a list, sending that out throughout the council. Then people just use the list whenever they want to order food. And this process has worked really, really well. It takes the anxiety and the fear out of it, so we're just trying to make it as easy as possible for councils. But also it creates opportunities for those conversations around what people think is healthy and what isn't healthy. So where to next? In November, we're having a forum similar to this one with the councils and looking at what they've been doing, what have been the enablers, what have been the barriers. Our project itself finishes the end of this year, but we have a number of champions, lots of stakeholders and partners. So we want to just put things in place now so it'll continue past December 2013. We're continuing with the food side of it and also looking more closely at how healthy eating policy is communicated within councils, because what we found was that people are really happy with healthy eating policy and healthy eating choices. That's not a problem. They find it quite easy. They're ready for it. But where it can get unravelled is if there's any hint that people are having choices taken away from them, or if they feel that they haven't been involved in the process and it's being forced upon them, or there's an inference that they don't understand, so people have to make those decisions for them. So we're spending some time just looking at the language of how these things are communicated through councils and the community. Looking a bit more closely at the implications with the Public Health Act 2011, and throughout this whole process the LGA are the main drivers. So if you want more information, we have a Twitter page, a Facebook page and a website. We have a generic email, so we're very happy if you contact us if you want more information or anything that we've developed. We're very happy to share that. And there's also the website page on the LGA of SA's website as well. And so I guess I just wanted to finish with saying that it has been incredibly inspiring hearing about what everybody's doing here today, and that healthy eating policy is a bit of an It's something small and specific that councils feel comfortable with starting with, and it starts those conversation, gets the right people around the table to look at it more broadly with regards to perhaps a food plan or something like that, and that healthy eating policy is very enabling and very empowering, and it does create that support that enables some of these other strategies to happen. Thank you.